Typically, when you ask the public about gun violence, they see it largely as a criminal justice issue. At the center, we see violence as a public health crisis, a public health emergency.
By definition, gun violence is a public health issue, right? It is a leading cause of death and injury in our country, especially for children and young adults.
It's also the #1 way that people die by suicide.
Gun violence is a public health issue because it is related to trauma in cyclical ways. People who have themselves been harmed are more likely to cause harm in the future.
So we know when a young man or a young woman is suffering from some traumatic experience, not just someone being assaulted, it could be someone witnessing it and they're lashing out. We understand that violence operates like an infectious disease.
And we know from research that the incidence is much higher in communities of color. It's not because they want to. They didn't have maybe a lot of the opportunities that some of us have.
Where I come from, there's a lack of education and there's a lack of health.
We really need housing security, job security, access to education, conflict resolution to feel safe, supported, and healthy.
Research shows that community violence is the result of long-standing structural inequities. A public health approach means addressing those long-standing inequities to get at the root of the problem.
This is a preventable cause of death. This isn't naturally occurring. This is something we can do something about in order to save the lives of our young people.
We can tackle gun violence prevention from a new angle that may help us to see new opportunities to engage community members around mental health and create a strong research foundation that can help us to change policy.
The evidence suggests that there are solutions. When we offer the supports to people at the center of the violence, they want it. They are ready for change and they are looking for opportunities. And I know that change is imminent.